Hello and welcome to The Explainer. Today, we're diving into a topic that so many parents worry about, H. pylori. You've probably heard that name connected to stomach problems in adults, but what does it really mean when it's your child who has that nagging tummy ache?
Your child's stomach hurts, and your mind immediately starts racing. Could it be that H. pylori bug you've heard about? It's a completely natural question to ask, but you might be surprised to find out that, for kids, the answer is usually not what you'd expect.
And here it is, the single most important thing to know right up front. For children, the answer is almost always a big, resounding no. When it comes to H. pylori, you have to throw out everything you know about adults, because for kids, the rules of the game are completely, and I mean completely, different.
So, to really get why the rules are so different, we first need to understand what this H. pylori bug actually is.
Okay, so Helicobacter pylori, or H. pylori for short, is a type of bacteria that sets up shop in the stomach. Now, in the adult world, it's a known troublemaker, right? It's famous for causing ulcers and other stomach grief. But for kids, and this is the key, it almost never causes any serious illness.
And get this, it is incredibly common. Around the world, about a third of all children have H. pylori living in their stomachs. Now, you'd think that would mean an epidemic of sick kids. But nope, the vast majority of them have zero symptoms. The bug is there, but it's just hanging out. It's not making them sick. And that brings us to the core of the issue, this huge mismatch between kids and adults. Let's break down exactly why doctors have a completely different playbook for children. The difference in symptoms is just night and day. In adults, H. pylori is a clear culprit for things like painful peptic ulcers and that chronic indigestion feeling. But in kids, the science just doesn't back it up. For that typical recurrent tummy ache, H. pylori is almost never the cause. Most kids with the bacteria feel totally fine. And here's the other kicker. If you treat an adult and get rid of the bacteria, it's usually gone for good. But for kids, it's like a revolving door. Even if you go through the whole treatment process, there's a 20% chance or even higher that they just get reinfected. It's so common for them to just pick it right back up. So, with all that in mind, the big question is, when should you even consider testing your child? Let's walk through how doctors separate a simple tummy ache from something more serious. Okay, this is the most important guideline right here. If your child just has what doctors call functional abdominal pain, a tummy ache without any other scary symptoms, testing for H. pylori is not recommended. It's just not the answer. Hunting down the bacteria in this case isn't going to solve the problem. So when is testing the right move? Well, it's only for very specific and serious conditions. If a doctor does an investigation and finds that a child actually has peptic ulcer disease, real ulcers in their stomach, then yes, you test. Same goes for an extremely rare cancer called malt lymphoma. These are the only clear-cut reasons. The key for parents, then, is to know what doctors call alarm signs. These are the red flags that suggest something more is going on. We're talking about things like your child losing weight for no reason, persistent vomiting, being woken up from a deep sleep because of the pain, or having anemia that just won't get better. These are the signs that say, okay, time to see the doctor and investigate further.
All right, so let's imagine that one of those alarm signs is present, and a doctor agrees that testing is the next step. What does that process actually involve?
For kids, we don't start with a simple breath or stool test. The proper way to diagnose this involves seeing a pediatric specialist. They perform a procedure called an upper endoscopy, where a tiny camera is used to look directly at the stomach lining. Only then, if they see something like an ulcer, will they take a tiny tissue sample, a biopsy, to test for the H. pylori bacteria.
And if that test is positive, well, the treatment is no walk in the park. It's a pretty intense cocktail of drugs. We're talking about a medication to reduce stomach acid, plus at least 2 powerful antibiotics, all taken for 2 full weeks. That is a serious undertaking for any child. And even after that tough 2-week regimen, it's not a sure thing. In the real world, treatment fails about 20% of the time. That's 1 out of every 5 kids. Now think about that. you have a 1 in 5 chance it won't work, and you combine that with the high risk of getting reinfected, you can really start to see why doctors are so reluctant to even start down this path.
So all of this leads us to a simple but powerful philosophy when it comes to H. pylori in kids. Less is more. The goal isn't to wage war on a common bacteria, it's to focus on what's truly best for your child's overall health.
I think this quote from the latest official guidelines just says it all perfectly. The real mission is to find the cause of the symptoms, not just to find a bacteria that, in all likelihood, is just an innocent bystander.
And, being careful here isn't just about your kid. There is a much, much bigger picture. Every single time we use antibiotics when they aren't truly needed, we help create superbugs that are resistant to our medicines. So being smart about H. pylori testing helps protect our kids, and it helps protect all of us from the growing threat of antibiotic resistance.
And that leaves us with this final thought. It's the tightrope that all of us, parents and doctors, have to walk. How do we stay alert and watchful for those rare alarm bells that really matter, while at the same time avoiding a pointless war against a common bug that's almost never the bad guy in a child's story? Thank you for joining us on The Explainer.